Come in.
Hi, my name is Melissa. I'm going to be your nurse today. Can you please tell me your first and last name and date of birth?
Raul Martinez, June 27, 1987.
Great. So today what we're going to be doing is your head to toe assessment. This is going to consist of touching certain areas of the body, your face, and flashing some light into it. Is that okay with you?
Yeah, that's right.
Okay. Do you feel comfortable where you are right now and safe?
Yes.
Perfect. I'm going to go ahead and close this curtain here. I'm going to wash my hands and put some gloves on, okay?
Okay.
So we're going to begin with some questions. Can you tell me what day of the week it is?
It's Friday.
Okay, great. And can you tell me who the president is?
Donald Trump.
And do you know where you are right now?
In my living room.
Perfect. So you're alert and oriented to person, place, and time. And your speech is distinct and clear. I can see here that your nails and hair is well groomed. Your head is sitting above your shoulders. I do see that there's no rips or tears on your clothes or stains, so it's well cleaned and you're dressed appropriate for the weather. Moving over to your head, I see here that your hair is evenly distributed. I don't see any parasites, lesions, patches, or bumps, and it's normal cephalic. Do you feel any tenderness?
No.
Perfect. Moving over to your face, I see that your skin color is evenly distributed and it is consistent with the rest of your body. I'm going to go ahead and test your cranial nerve number 5, and this is the trigeminal. So if I can have you close your eyes, I'm going to touch certain areas of your face, and if you could just repeat where it is that you're feeling it, okay?
Forehead. Chin. Cheek. Jawbone. Cheek. Temple.
Perfect. So cranial nerve number 5, trigeminal, is intact. And then for cranial nerve number 7, the facial nerve, and also I'm gonna go ahead and pull down on your jaw, but don't let me open it, okay? Okay, so this is part of your cranial nerve number 5, along with sensation. So cranial nerve number 5, trigeminal, is intact. Moving over to cranial nerve number 7, the facial nerve. So if I can have you smile, frown, okay, and then raise your eyebrows. Okay, now I'm gonna have you close your eyes tightly, and then don't let me open them. Perfect. So cranial nerve number 7, facial nerve, is intact. Moving over to your eyes, I can see that they're symmetrical, your eyebrows as well. If I can have you pull down on your eyelids. So I can see your conjunctival sacs are nice. You can go ahead and are nice and pink. I didn't see any lesions. I didn't see any swelling or any foreign bodies. Your sclera is nice and white. And so just to improvise here, what I'm going to have you do is I'm going to have you go ahead and stare at the wall over there. Okay, and then now stare at this. Okay, great. So your eyes accommodate to near and distant objects. We're going to pretend that this is a light. So what we'll do is I'm going to flash the light on your eye. I'm just going to have you stare over there. I'm going to flash the light over your eyes, okay? Okay. Okay, so your pupils are reactive to light. There are 3+. So your eyes have perla. So now what we would do next is we would be testing cranial nerve number 2, which is your optic nerve. And that would consist also of testing visual acuity. But in this case, we don't have the Snell chart. But if we did, what I would have you do is I would have you stand 20 feet away from the Snell chart. I would have you close an eye and then cover one of your eyes and then read one of the lines. And if you do that successfully, I would move you down to the next line and we would repeat with your other eye. So let's say you do go ahead and do that successfully and you're 20-30. That means that what you see at 30 feet, other people see at 20 feet. Okay, and then your optic nerve, cranial nerve number 2, would be intact. Moving on, we are going over to your nose. I can see that your nose is midline. I don't see any deformities. I don't see any lesions or bumps. I don't see any discharge. If I can have you close one there, breathe in and out. And then repeat on the other side. Perfect. And then I'm gonna go ahead and move over to your mouth. So I see that your lips are pink. They're nice and moist. I don't see any over dryness. I don't see any cracks, any lesions or bumps. If I can have you open your mouth. All right, and then can you stick your tongue out for me? Okay, and then just put your lip down. Okay, and then stick your tongue up. Okay, so I can see that your gums and your mucosal membrane is pink and moist. I don't see any lesions or bleeding. The bottom part of your tongue is nice and smooth and vasculature. The top of your tongue is nice and rough and pink with no lesions. So your tongue protrusion is midline. So your cranial nerve number 12, the hypoglossal, is intact. If I can go ahead and have you open your mouth again and say ah. Okay, perfect. So your tonsils are a 2+. They're nice and pink with no exudate, no swelling. Your uvula is nice and pink with bell-shaped and moist, and it rises with phonation. So that means that your cranial nerve number 10, the vagus nerve, is intact. And if I can have you go ahead and swallow for me. Okay, so you went ahead and swallowed without difficulty. So cranial nerve number 9, the glossopharyngeal, is intact. So moving over to your ears, I can see that your ears are aligned with your eyes. I see that they're symmetrical. I don't see any deformities, any lesions, or any bumps. I'm gonna go ahead and pull on them and push on your targets, and you just let me know if you feel any tenderness. Any tenderness? Okay. Any tenderness? And then looking here at your external auditory meatus, I don't see any wax buildup. I don't see any lesions or swelling or foreign bodies. Same on this side. So now we're going to test your hearing acuity, which is also testing your cranial nerve number 8, the acoustic or vestibular clavicular nerve. So if I can have you cover one ear, I'm going to go ahead and whisper something, and then you just repeat it back, okay?
Food.
Okay.
Cold.
Okay, perfect. So cranial nerve number 8, the acoustic or vestibular clavicular nerve, is intact. Now we're going to go ahead and move down to your neck. I can see that your neck is midline. I don't see any involuntary movement. Your skin distribution is even and consistent with the rest of your body. I'm going to go ahead and feel on your lymph nodes, okay? You just let me know if you feel any tenderness. So we have your preauricular lymph node, your postauricular lymph node, your occipital lymph node, your tonsillar lymph node, your submandibular, your submental. You have your anterior cervical, your posterior cervical, and then your supraclavicular lymph nodes. I didn't feel any swelling. Did you feel any tenderness?
No.
Perfect. And then lastly, we're going to test cranial nerve number 11, and this is the spinal accessory nerve. I'm going to go ahead and hold down here, and you just shrug up against it. Perfect. Now go ahead and turn your head into my hand. Okay. And repeat. Okay, perfect. So you went ahead and did that well. So cranial nerve number 11, the spinal accessory nerve, is intact. Now we're going to move down to your chest, back, and your lungs. So what I'm gonna do first is I can see that your anterior posterior diameter is less than your transverse. I'm actually gonna have you, if you can stand up and turn around. We'll start with your posterior side. This way, just for camera purposes. Okay. So what I'm gonna have you do is I'm gonna have you take deep breaths for me, okay? Let me just, okay. So if you can go ahead and take deep breaths. One more. Perfect. So you can go ahead and stay like that. So I can see that your thoracic expansion is symmetrical. Now what I'm going to do is, if I can have you say 99, make sure you say it kind of loud. Say 99, just repeatedly.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So your vibrations are even throughout. And just for the video purpose, your respiratory rate was 16 beats per minute. Your respiration was even and unlabored with no usage of accessory muscles. Now, just because I have you this way, I can see that your spine is aligned with no signs of scoliosis, lordosis, or kyphosis. And now what I'm going to do is I'm going to percuss, and then you just let me know if you feel any tenderness, okay? Any tenderness?
No.
Any tenderness?
No.
Okay. So there's no costovertebral angle tenderness. And then now I'm going to go ahead and listen. And I would usually do this under the skin, not over any clothes. So if you could just take deep breaths as I move on, okay? Perfect. And now if I can have you turn this way, and just start, lift your arm up. All right, just take a deep breath. And repeat. Okay, and then if I can have you face this way. Okay, perfect. Now I'm gonna go ahead and listen to your lungs, okay? And just take deep breaths. Just breathe normal. You don't have to like force it. Just make
Use
them.
that deep breath. Okay, and then let's turn this way. All right, go ahead and take a deep breath. Okay, perfect. Now go ahead and have you turn. All right, so your lung breaths are clear with no adventitious sounds added. So you can go ahead and take a seat if you like. Thinking. So now moving over to, I'm gonna go ahead and feel on your carotid artery. Okay, and then on the other. Okay, so your pulse is a 2+,
and now what we're gonna do is I'm gonna listen to your carotid artery. So I'll have you take a good breath and then just hold it, okay? So go ahead and take a good breath. Now hold it. Breathe. Okay, and now we're gonna go ahead and repeat that again. So take a good breath, hold it. Okay, perfect. So I don't hear any bruits, so any swooshing. And so now we're moving over to your chest here, and I don't feel any heaves or any thrills. Do you feel any tenderness?
No.
Okay, perfect. Now I'm going to listen to your heart. So here at your right second intercostal space, you have your aortic point. Over to the left on your second intercostal point is your pulmonic. At the third intercostal left side, you have your Erb's point. At the fourth intercostal space on the left side, you have your tricuspid. And mid-clavicular line here, at your fifth intercostal space, you have your apical or mitral point. Great. So S1 and S2 are clear with no added sounds or murmurs. And so now I'm gonna have you just, what you can do is just lay back. So just for the purpose of the video, we're gonna do your abdomen. Okay. Let me just make sure it can be seen. I don't think she can see you there.
I'll move over to this side.
Yeah, you're fine right there. That's good. Like that. Just leave it there. Let's leave it. Leave it.
No, I kind of like that one.
Okay, so looking at your abdomen, I can see that it is rounded and convex. I don't see any lesions. I don't see any deformities or any bumps. I'm gonna go ahead and listen to it. So vowel sounds were present in all four quadrants and they were normal active. I'm now gonna lightly push down on your abdomen, okay? If you feel any tenderness, you just let me know, okay? Any tenderness? No? Okay, perfect. I didn't feel any masses. I didn't feel any rigidity or guarding. Do you have any concerns with your bowel movements or urine output?
No.
No? Okay, perfect. So now I am going to have you sit back up, please. Thank you. And we are going to now test your musculoskeletal. Okay. So looking here, if I can have your hands, please. Looking here at your arms and your hands, I see that your skin is evenly distributed, the color, and it's consistent with the rest of your body. Your hands and your arms feel warm. I don't see any swelling. I don't see any lesions or any bumps. Looking at your feet and your legs, they feel warm. I don't see any swelling or any lesions or deformities. So then now I'm going to check your capillary refill.
Okay. Perfect. So your capillary refill was less than 2 seconds. And now I'm gonna test your balance and check your walk. So what I'll have you do is I'm gonna have you come right here. And I'm just gonna have you walk across and then just walk back normal. Perfect. And then just go ahead and stand right here. So your gait was effortlessly and your arms were swaying accordingly. Now we're gonna test your balance. So if I can have you just stand up straight, arms to the side, and then I'm gonna have you close your eyes and we're gonna be here for 20 seconds, okay? Just stand straight. Okay, so 20 seconds. I didn't see any swaying or unbalance, so the wrong bird test was negative. I'm gonna have you stand here because we're gonna do a couple of other things. So now we're gonna check your that's next. We're gonna check your range of motion. So let me just make sure you're in the view here. Perfect. So if I can have you put your arms up, bring them back down to the side, and then we're gonna do hyperextension, so back. Okay, so hyperextension, abduction, and adduction of the arms is a 5 out of 5. Now I'm gonna have you look up, all the way up. Okay, all the way down, chin touching your chest, and then just rotate your head in a circle. So flexion, hyperextension, and rotation of your neck is a 5 out of 5. Now if you can go ahead and take a seat. And if I can have you extend your legs out. Well, like actually, yeah, well, there you go. Now bend them. Okay, good. And then now if I can have you put together and push out. Okay. Good. So extension, flexion, and abduction of the legs is a 5 out of 5. So we're gonna check your strength here. If I can have you push out. Okay, perfect. And then now if you can stand up. Okay, and I'm just gonna have you, I'm gonna try to pull and you pull away, okay?
Standing straight.
Yeah. Okay, perfect.
Alright.
All right, go ahead and sit down again.
Okay.
Sorry. And then now I'm gonna have you push up on my hands.
Like that, or just raising them?
Yeah, like push up with your feet. Okay? And then push down.
I don't want to push your hands.
It's okay. And then go ahead and grab my fingers and squeeze. Okay, great. So strength on your shoulders, hands, dorsiflexion, plantar flexion is all 5 out of 5. Okay, so now we're gonna go ahead and move over to your reflexes. And we're just gonna improvise here. So we have your bicep. So I'm gonna have you put your arm like this. And you're just gonna relax it, like dead, in my hand. Just let it fall in my hand. Perfect. So this is your bicep reflex. Okay, and it's supposed to flex. And this is all bilateral. All right, let it fall dead in my hand. Okay. Now we are gonna go ahead and do your tricep. So if I can have you put your arm like this. Yep. Let it fall dead. Okay. All right. And now this is the brachioradialis at the radius, 3 centimeters out. You're gonna loose, okay. Okay. Perfect. And then if I could just have you sit back just a little. And now this is the patellar reflex. Perfect. and the Achilles reflex. Perfect here. We would see contraction of the calves. And then lastly, the plantar, which I would do. With the plantar, okay, so there was flexion of the toes, so Banksy sign is not negative.
Oh shit.
Same. Great. And then lastly, I'm gonna go ahead and check your pulse. Okay. So I feel more comfortable doing. So you have your brachial, which is a 2+. Bilaterally, we have your radial. It's a 2+. Bilaterally. We have the popliteal. It's a 2+ bilaterally. You have your posterior tibial. Which is a 2+ bilaterally, and then you have your dorsalis medius, which is a 2+ bilaterally. So this concludes our head to toe exam. Do you have any questions or concerns?
Nope.
No? Okay, great. So I'm going to go ahead and open the curtain. I'm going to leave you with your belongings. If you have any questions or concerns, feel free to reach out to me. I'm going to go wash my hands and have a great day.
Have a great day.
Thank you.